Okay, we're live. Okay, go ahead.
So I'm Mike Hori, and I'm an infectious disease specialist at UW Valley Medical Center. I am board certified in infectious diseases, and I've been here for about 30 years. And I'm here to talk today about the new Wuhan coronavirus respiratory infection. I understand we actually have a case now in the Great Pacific Northwest, and I'm presenting a little bit of information for people who are interested in this particular problem that we're having at this time.
Hey, thank you for being here, Dr. Hori. Can you tell us more about what this virus is?
Well, the coronavirus is a respiratory virus. It has been around for a very long time, and for the vast majority of infections that it causes, it's just a cold. Runny nose, sore throat, dry cough type of syndrome. There have been two exceptions that we're aware of in modern medical history, one of which has been the SARS virus back in 2002, which was the severe acute respiratory syndrome, which was a very serious disease, but fortunately it was contained very quickly, and we haven't seen that since 2002. And then the Middle East respiratory syndrome virus, which has also been a coronavirus, which is still active in the Middle East. Again, here at Valley Medical Center, we've never seen a case of it. But for the most part, the coronavirus has been mostly just a cold type of virus. But we do know that it can cause serious disease. And therefore, this new virus in Wuhan, we're taking very seriously as a potential cause of serious infections.
Okay. People might be concerned about traveling. Anything that they should think about before they go to the airport or going anywhere that they might be in contact with people?
Well, there's a couple things. The first is that, as far as I know, the total number of cases worldwide at the moment is probably around 300 or maybe less, which is not very many cases. So the likelihood that you're even going to run into somebody who has a problem like this in the airport is probably low. And the other thing that we are hearing from our colleagues at the Center for Disease Control is that it takes what they're considering prolonged contact with the patient. And when we talk about contact, we're talking with about 6 feet of the patient, because that's generally how coronaviruses have been spread in the past. It's what we call droplet spread as opposed to airborne, which means that usually it's just a relatively small area around the patient that could be infectious, and you should be around that patient for a longer period of time. And so what we're hearing is that that particular duration of time is, if you're caring, the duration of time it might take to be in a room if you're caring for them, or if you're visiting them for a period of time, or if you are living with somebody, for instance. These are sort of the durations that we're talking about. So casual contact in the airport is very unlikely to spread the disease at this point.
And then what about traveling to Asia? We know it's the Lunar New Year and a number of people are going home to Asia, to China and other countries to visit families and friends there.
Mm-hmm.
Should people not go to Asia, or what concerns might we have about that?
Well, again, the communities in Asia are rather large. I mean, we were talking about Wuhan being about 12 million people in and of itself, and again, the number of cases being relatively small. So once again, it's kind of unlikely that you're going to be exposed to something like that. Still, it's probably a good idea to use precautions, make sure that you cover your mouth and encourage other people to cover their mouths if they're coughing, and wash your hands frequently. But I do think it's probably safe to travel if you already have made arrangements to do so. And again, during this holiday season, that seems like something that many people are doing.
So you mentioned earlier about how the symptoms are like having a cold. At what point should somebody seek care? Go to their doctor or call their doctor if they think that they have been around somebody who's been in Wuhan. What do you recommend?
Well, again, we are only concerned about people who have been in Wuhan right now, or people who are exposed to people who have been sick who are from the Wuhan area. The incubation period is about 2 weeks. So if you've been away from there for longer than 2 weeks and you get sick, again, the likelihood that you're developing this disease is low. And the same is true for people you might be in contact with. The symptoms that we're looking for are fever, cough, or shortness of breath. So fever plus some respiratory symptoms. Fever might not always be the case. If there's somebody who's compromised, who has, for instance, cancer chemotherapy or on certain immune suppressing drugs, they may not mount a fever, and the very young and the very old may not either. So respiratory symptoms with the proper exposure may be enough to worry about, and seek help. I do think if you fall into that pattern, you probably should seek help, but I would encourage you to contact your provider before you come down to kind of let them know so that they can make the proper arrangements ahead of time, or perhaps have you go to a place where proper arrangements can be made and more help can be brought forward for you.
Okay. Do you have any other recommendations you might give, or if people want to learn more and stay on top of this so that they're getting accurate information, what information might you give them?
Well, both the CDC has a Wuhan. I just typed in CDC Wuhan, and you'll get an information sheet from them. And the same is true from the King County Health Department. You can just type in King County Health Department Wuhan, and there are a couple of nice information sheets that summarize what we know about the situation so far and what precautions you should take and your healthcare facility should take to avoid spreading the disease while other people are there, if they should happen to have a case.
Okay, well, great. I think that's our questions. We appreciate you taking the time, and we'll let you go and get back to seeing your patients. Thank you, Dr. Hori.
Thank you.
All right.